Good afternoon. My name is Shanika Thompson and I'm a healthcare educator, and I'm dedicated to saving lives by protecting the health of every community and working to make disease prevention a national priority. Today I would like to discuss making Heart Health a National Day where the community will unite in the fight against cardiovascular disease. Cardiovascular disease is the leading cause of death and disability in the world. More than 800,000 people in the United States die from cardiovascular disease each year. That's 1 in 3 deaths, and about 160,000 of them occur in people under the age of 65. Approximately 1.5 million heart attacks and strokes occur every year in the United States. Heart disease kills roughly the same number of people in the United States each year as cancer, lower respiratory diseases, including pneumonia, and accidents combined. Heart disease and stroke cost the nation an estimated $316.6 billion in healthcare costs and lost productivity. Together, heart disease and stroke are amongst the most widespread and costly health problems facing our nation today. On a personal level, families who experience heart disease or stroke have to deal with not only medical bills, but also lost wages and the real potential of a decreased standard of living. Heart disease and strokes together has a greater toll on Americans' health than any other condition. Cardiovascular disease affects young and old, women and men, rich and poor, and all racial and ethnic backgrounds. We can expect an even greater number of heart attacks and strokes and mounting costs of care for victims and their families unless we as a nation renew and greatly intensify our public health effort to prevent these conditions. The importance of these conditions is not restricted to just the older population, although the number of victims at older ages are especially at a greater risk. Risk factors such as diabetes have increased dramatically even for younger people. The World Health Report 2002 identified 6 risk factors that are relevant for cardiovascular disease, which includes high blood pressure, high cholesterol, tobacco use, alcohol use, low fruit and vegetable intake, and obesity. The magnitude of the benefits that can be achieved by reducing these risks makes intervention cost effective. Growing health disparities place certain populations, especially racial or ethnic minorities and people of low income or education, at excess risk relative to groups with the most favorable rates of heart disease and stroke. It is clear that heart disease and stroke contribute substantially to the nation's healthcare crisis. Heart disease and stroke threaten the health and well-being of all Americans, especially during the middle and older adult years. Prevention is possible by reversing community-acquired behaviors, risk, and health disparities. If we fail to intensify preventive efforts now, it will escalate the future burden and cost of these conditions. National Heart Day will play a crucial role in changing all of this. It is a vital national platform that we, as well as our members, patient groups, and supporters, can use to raise awareness and encourage individuals, families, communities, and governments to take action now. This platform aims to drive action to educate people that by controlling risk factors such as tobacco use, unhealthy diet, and physical inactivity, at least 80% of premature deaths from heart disease and stroke could be avoided. We believe that everyone has the right to a healthy heart, so by looking after your heart, that means taking small but meaningful actions such as eating a balanced diet, participating in regular exercise, reducing your alcohol intake, and not smoking. All of the things that make you not only healthier, but also be able to enjoy your life to the fullest. National Heart Day will be a national campaign in which individuals, families, community, and governments around the nation will participate in activities to take charge of their heart health and that of others. Through this campaign, National Heart Day will unite people from all over the nation and of different backgrounds in the fight against cardiovascular disease, and inspire to drive the nation to encourage heart-healthy living across the world. National Heart Day can be seen as an ideal opportunity to scale up efforts at the nation's level with a globally led initiative. A whole day dedicated to cardiovascular disease prevention is an effective way of engaging the media, the public, policymakers, and health professionals in information dissemination, awareness creation, and advocacy. Activities would include runs, sports, events, dancing, and cycling in public spaces. This day would aim to create a national community of heart heroes who would make a promise to themselves and those they care about to look after their heart. For individuals, it would be a promise to our families to cook and eat more healthily, and a promise to our children to do more exercise and to help them to be more active and to say no to smoking and help our loved ones to stop. For healthcare professionals, it would be a promise to help our patients give up smoking or to lower their cholesterol and to understand the risk of cardiovascular disease. And for policymakers, it would be a promise to support policies that support heart health. In conclusion, heart attacks and strokes can be prevented or delayed if the knowledge we have already is put into action now. Together, we have the power to reduce the burden of and premature deaths from cardiovascular disease by helping people everywhere to live longer, better, heart-healthy lives. Thank you again for this opportunity to speak.